Assalamu alaikum. I am Dr. Syeda Farzana Yesmin, Associate Professor Gynae Obst at the Akij Medical College, Khulna. Today we will discuss about D, E and C. Also D and C. What is D and C? It is dilatation of the internal os and curettage of the endometrial cavity. And it is a frequent gynecologic procedure. It is the commonest gynecological operation. And what are the indications of DNC? Why we should do DNC? We do DNC for diagnostic purpose and also for some therapeutic purpose. In case of diagnostic purpose, we do DNC in some situations like postmenopausal bleeding, in case of infertility, in case of dysfunctional uterine bleeding, menstrual disturbance, dysfunctional uterine bleeding in other menstrual disturbances. So, we do DNC in some diagnostic purpose. The purposes are menstrual disturbance, first menstrual disturbance, second infertility, third postmenopausal bleeding. Menstrual disturbances includes incomplete abortion, dysfunctional uterine bleeding, endometrial polyp, endometrial carcinoma, also choriocarcinoma, dysfunctional uterine bleeding. When we suspect the cause, maybe cause is not known to us, we do DNC to reach the diagnosis. In case of menstrual disturbance, these are incomplete abortion, suspected incomplete abortion, endometrial polyp, endometrial carcinoma, choriocarcinoma, dysfunctional uterine bleeding. Infertility workshop, we do infertility cases to detect the secretory phase of the endometrium, which is an evidence of ovulation. And in case of postmenopausal bleeding, we also do DNC to exclude choriocarcinoma or endometrial polyp. We do frequently DNC in some therapeutic purposes. These includes in complete abortion, inevitable abortion, missed abortion, hydatidiform mole, also in case of DUB to control the bleeding, in case of DUB to control bleeding, in case of polyp to remove the polyp, and also in case of displaced IUCD to remove the IUCD, we do DNC. So, for therapeutic purpose, the causes why we should do DNC as therapeutic purposes are abortions, which includes incomplete abortion, inevitable abortion, missed abortion, hydatidiform mole, endometrial polyp, also in case of DUB to control bleeding, and displaced copper T. Can we do DNC as a diagnostic, also therapeutic purpose? When DNC or when DNC serve both diagnostic and therapeutic purpose. To some situations or conditions where DNC help us as a diagnostic procedure, also as a therapeutic procedure. Two situations are in case of dysfunctional uterine bleeding and endometrial polyp. What are the contraindications of DNC? When we should not do DNC? In case of pregnancy and pelvic infection. In pregnancy and pelvic infection, we should not do DNC. There is chance of flare up of infection if DNC is done in pelvic infections. We first control infection, then we do DNC. So, in two situations, we should not do DNC. In case of pregnancy and in case of pelvic infection. What are the preoperative management of DNC? Like other operations in DNC, we need preparation of the patient for operation. The DNC is a minor procedure, minor operative procedure, but it needs some preparation of the patient. We should do routine investigations like other operations, which includes blood grouping, RH typing, complete blood picture, random blood sugar, thyroid screening, serum TSH, also HbA1c and ECG. We should take consent from the patient and her husband, and we should keep the patient fasted for 6 to 8 hours before operation. The operation done usually under general anesthesia, so anesthetic fitness is required for before DNC. Anesthetist should feed the patient before the operation, then we should do the operation. What are the procedure of DNC? So we know that DNC done both in gravid uterus and non-gravid uterus. In non-gravid uterus, we usually do DNC for some diagnostic purpose. In non-gravid uterus, before the patient enter into the OT, she should evacuate her bladder, then will enter into the operation theatre, and she is usually lies supine position first in the OT table. Then anesthesia given, we place her in lithotomy position. The two legs are raised simultaneously. Two legs are raised simultaneously to avoid any strain on the back of the patient after operation. Her vulva vagina should be swept clean by gauze, which is held with a sponge holding forceps, and washed with povidone iodine solution properly. Then the vulva should be surrounded by sterile sheets, draping sheets, we call it draping sheet. Then the bladder can be evacuated with a metallic catheter. Then the doctor should do a pelvic examination before the procedure. This pelvic examination will help us to know about the size, position of the uterus, also any pathology present in fornices. We do pelvic examination to know the size, shape and position of the uterus, and when we palpate the fornices, we can exclude any pathology in the ovary, any tumor or any other conditions. Pelvic examination is mandatory before the actual procedure. We should do pelvic examination to see the size, position, shape and mobility of the uterus, also to exclude any pelvic mass which can be palpated through the fornices or any thickening present in the fornices. Then after pelvic examination, we should want to see the cervix. So we introduce Sims posterior vaginal speculum slowly within the vagina. Then we grasp the interlip of the cervix with a valsalm. Then cervix is drawn slightly down, and then we first introduce uterine sound slowly within the uterine cavity through the internal os. We introduce the uterine sound to measure the length of the uterus. To measure the length of the uterus, we introduce the instrument softly, gently within the uterine cavity to avoid any perforation. Then we draw back the uterine sound, and cervical canal is then gradually dilated, introducing dilators, Hegar's dilators. And in ordinary curettage, in case of ordinary curettage, dilatation up to 10 millimeter is sufficient. But in case of suspected product within the uterine cavity, up to 10 millimeter dilatation is sufficient. Then curettage is done in case of non-gravid uterus. As the procedure is going on non-gravid uterus, the curettage is done. The curette is gently introduced into the uterine cavity by keeping the concave surface forwards. Then the curette is introduced up to the fundus. Then we start the curettage procedure at 12 o'clock position. Then working round the cavity in a clockwise direction in anterior, left lateral, posterior, right lateral wall. Then the scrapings are collected separately and sent for histopathology. These curettings are preserved in 10% Formo solution, 10% Formo saline, and sent for histopathology. After curettings are then inspected, also the curettings are inspected for gross appearance, and first the curettings are collected in a gauge, and then the curettings are inspected for their gross appearance and picked up with plain forceps. Then the materials are transferred to vial containing 10% Formo solution. Then the Volslam is removed and the Sims speculum also removed, and pervaginal wash done with povidone iodine solution, and the both legs are draw back to the supine position simultaneously, and we then prepare the curettings to send it to the pathology for histopathology. And the histopathology paper should include the name of the patient, age, bed number, ward number, and the specimen which is endometrial tissue, and the type of investigation should be done, which is histopathology, and it may include short history of the patient, and also the last LMP, last menstrual period, may be mentioned in the histopathology paper. Careful detailed operation note should be recorded for future management of the patient. These are the DNC procedure in non-gravid uterus. In case of gravid uterus, when we do DNC in case of gravid uterus due to incomplete abortion, inevitable abortion, missed abortion, the procedure is somehow different. These includes in case of pregnant uterus, we assess the size of the uterus per vaginal examination, and we avoid introducing of any uterine sound to avoid perforation of the soft gravid uterus. So we avoid uterine sound in case of pregnant uterus, as there is chance of rupture, chance of perforation of the uterus. And as the cervical canal is already open, in case of incomplete abortion, we avoid any dilatation with any dilator which is not required. And if the cervical canal admits one finger, we first separate the product of conception with one finger, then we evacuate with finger or sponge holding forceps in such a case where finger easily can be introduced into the uterine cavity. And if the cervix is closed, especially in case of missed abortion, we first give some drugs or we use laminar ear tent to open the cervix, then we go for the actual procedure. And to open the cervix, we can use misoprostol, which is a synthetic analog of prostaglandin E1, which is given before the operation, which is given in the ward. And when the cervix is open with the misoprostol or synthetic prostaglandin E1, then we do the DNC in operation theatre. So, in case of incomplete abortion, we explore the uterine cavity with the help of a sponge holding forceps or ovum forceps, and the instrument is introduced in a closed state, gently introduced into the uterine cavity. Then the catch is unlocked and the product of conception is held with the tip of the sponge holding forceps, and then the catch is locked, and gently rotating the sponge holding forceps, the uterine cavity is explored. And the procedure may be repeat of the procedure, it may require repeating of the procedure, and sponge holding forceps may be repeatedly introduced into the uterine cavity to explore completely the uterine cavity. When the uterine cavity is almost explored, then we introduce the curette gently into the uterine cavity, sharp end of the curette to clear up the endometrial cavity. Gently we start in 12 o'clock position, then rotate left lateral posterior, right lateral wall, and then the endometrial cavity, when we sure the endometrial cavity is empty, then we stop the procedure, and at the end of the procedure we give injection argometrin 0.25 milligram IV to avoid any hemorrhage. In next class we should know what is fractional curettes, what are the complications of DNC procedures, and some other questions in relations with DNC.